Gloves on. PPE been seen safe, Um, number of patients is one patient. Mechanism of injury, don't know that. ALS, call for ALS support, and consider C-spine. This is trauma. Um, from there, this is your primary assessment. You want to get your general impression, good impression. You get the patient's CBC, their level of consciousness, breathing, their skin color. They're 28 years old. You want to kind of align what the dispatch told you with what you saw. Age of patient, female. From there, you can see the patient labor breathing. Then from there, you assess the patient's awareness and orientation. So you go to the patient, you shake, hello, are you there? I mean, are you awake? If they don't respond, you give them, a painful stimulus on the chest or behind the arm. Then from there, if they're not responsive, they're unresponsive. From there, you go ahead and you go and you assess is there any major life-threatening things happening right now? Is any major life injuries right now? You ask that question. The chief complaint. You kind of investigate the chief complaint. Then from there, you go ahead and assess the ABCs. So you go and assess airway. Is airway intact? You want to check the patient's mouth. You want to inspect it for any like debris or blockage, teeth or blood or whatever blocking the airway. Then from there, if you got a suction, you got a suction. Then from there, you go ahead and apply a NPA or NPA or NPO or MPO, depending on the patient's facial obstruction. Then from there, you go ahead and ask if there's a gag reflex. There's no gag reflex, there's not. From there, you assess the patient's breathing. You see the patient's ventilation pattern. See if they're laboring. Sorry, I love this taking a long time. Then from there, you check the circulation. You check bilateral pulses on the radius. On your wrist. You check the pulses bilateral. You get the rate. From there, you check this patient's skin color, condition, and temperature of the skin. Then from there, you go ahead and see if there's any major bleeding. If there is, you control it. You ask the flow of the blood. What kind of bleeding is it? Then from there, you treat the patient for shock. So based on the patient's skin color, you assess for shock. Get warm blanket to conserve body heat, right? Then from there, you determine your patient's priority, high priority, low priority. Then you also determine the patient's treatment and transport decisions. This is the part where you actually choose what to do. Then from there, you ask the prompt person, have ALS arrived? If not, then you go to the nearest hospital. Or you meet them en route. Again, but how far is the nearest hospital? I don't know. Ask the prompter. Could be half an hour away. Could be heavy traffic. You call for air support, right? Then from there, you go on to your history. So in trauma, history is going to be vital signs and attempt to get a sample history. Okay, sample history, sample signs, allergies, medication. There's allergies, medication, pertinent past history, so brief history. Then from there, last meal eaten, taken, drink, and then the event, what happened, what were you doing before this happened. Then from there, you go to secondary assessment. You go to the head. You assess for DCAP, TLS, deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, or swelling, swelling and all in every spot. You want to just look for all that stuff. So when you start, this is kind of a long thing. I'll be done quick. Okay. You assess the head. You test the head here. You check your gloves for any bleeding. Okay. Again, you look for DCAP, TLS. Then from there, you check behind the neck, behind here. If the patient fallen back, they might have some swelling. While you're doing this, you ask the prompter, do I find anything? Okay. From there, you check the bone structures. You know, you check them, and you check the eyes, the sclera, for any, like, you know, jaundice or any bleeding. You know, any blood in the eyes or anything like that. Any protrusion of the eyeball. And you check the nose and the ears for any cerebrospinal fluid. So CSF, cerebral spinal. So CSF fluid in the ears, and any blood as well. Blood in the nose could indicate possible head fracture, right? Or ears. That'd be bad. Brain swelling. You check Perla, eyes reactivity, right, to see if they're reactive to light. If not, it could be a brain trauma injury. You check their mandible. You check their their jaws and all that stuff. You check the neck for the tracheal deviation. Sorry, love. You check for deviation. You check cervical. Also, you have your patient do C-spine. If you have a person to help you out, have a patient C-spine. Have your partner hold the neck. You check for cervical step box. You check clavicles. You check shoulders for any like dislocations. You check the chest for bilateral chest rise. You go ahead and just you can check for flailed chest. You can hear lung sounds, and any possible pneumothorax. You can hear the heart for any murmurs, any blood, any could be any aorta damage, trauma, blunt force. Who knows? Then if there's muffles, you got that the tamponade, pericardium tamponade, whatever, in the heart. You check the chest again. You hold here for any flail chest. That's like any loose ribs in your chest that could possibly puncture your lung after a trauma. Just loose, sharp bones when they break the sharp. Okay. Well, of course. Then from there, you go ahead and check. You can go ahead and check for, of course, any like chest wounds, right? Any chest wounds. You cut the chest, the hair, you cut the shirt. Then you go ahead and check for a abdominal. You palpate the abdomen, see any tenderness or swelling, any blood collection, bruising, can indicate underlying bleeding of liver or anything like that. From there, you go in and check the pelvis integrity to make sure the pelvis is intact, make sure there's no broken pelvises. From there, you go ahead and check your extremities. So you want to go here. You kind of want to as if how you just want to check it here. You want to just bend it this way. Just push this way, push downward to make sure it has integrity, it's not broken, same as here. Also check pulses as well, make sure there's circulation. From there, same thing here, you want to just check here, right? Check here. You can't check sensitivity because the patient's unconscious, right? You would ask them, what foot am I touching? But circulation is what is key here. You check femorals as well if you see any discoloration, any cooling pale color of the feet. And from there, that's a secondary assessment. From also too, patients like this are going to be we need a board to put on the board. So you kind of roll them over here, have the board here, have a team help you out. You roll the patient, you check the back of the spine all the way down their back, and then you check their if it's a butt, you check the butt too. There's gunshot wounds. It could be a bullet outside coming out the butt. And you also could, I've seen this before, but don't know, you could put your finger in the canal, in the butt, in the brown spot where you poop. Put your fingers too, and you see if there's any blood, possible bleeding, or an alien. Just kidding. All right. So that's secondary assessment. From there, you do your reassessment. It's going to be just tell the prompter how often you want to check on this patient. I wish there was more to it, but that's all you have to do. Then from there, you're pretty much done. So throughout this whole thing, you want to ask this is 10 minutes. You want to do this before within 10 minutes transport, and that's pretty much it. There's more to go. There's more about this, but I'm sure when the time comes to do this event and to do this procedure thing, we go ahead and tackle all the intrinsic questions and the prompter. You want to kind of impress. Anyway, that's it. Thank you so much, and have a happy Halloween. Take care. Thank you.